Good evening. Thank you so much for tuning in. I'm Amita Balachandra. This is the Rural Report where we take the focus away from the big metros and only talk about what's happening in rural areas across the country. We're also going to talk about how not just the pandemic but also climate change has affected rural India, because remember, rural districts are the most vulnerable according to reports. And I want to pick up one report that this Center for Science and Environment has put out. It's called State of India's Environment and Figures 2021, and this is what they've said rural India is the worst hit by second wave of COVID. They also talk about shortage of doctors, shortage of radiographers, lab technicians in rural areas. They also talk about how India alone accounted for more than half of the daily global cases on 6 days, and the peak, according to this report, was due to a surge in cases in rural districts. There's also conversation on Manrega and how it's witnessed massive payment lags as well. And this is something that we're going to talk about right now with Mr. Rajit Sengupta, who's the assistant editor of Down to Earth magazine, who is joining us. He's one of the authors of the report. He's going to give us perspective on all of the data that I've just mentioned. Mrs. Sengupta, thank you so much for joining us. If you can first of all help us put into perspective how rural India became the epicenter, and this is one of the points that I want you to talk about as well. In the report, it says that the peak was due to a surge in cases in rural districts.
Okay. So I'll just take you through, just to put in perspective. So the second wave in India started somewhere around mid-Feb is what we expect. And at that point in time, the epicenters were just Kerala and Maharashtra. Then the cases started actually hitting us really badly in April. So the cases actually started going up towards April. So towards the end of April, our analysis shows that the shift from urban areas to rural areas started. And by May, it has reached the rural India. Let me just put it in perspective. May is the month when India was basically out of every second cases globally was being recorded in India. So our analysis shows it was around 48% of all the global cases happened in India. And then the second step of that is this was primarily happening because of the sudden surge in cases in rural India. So our analysis shows, our analysis period is from May 1st to May 23rd. And in that, we found that 53% of the new cases that happened in May happened in rural India. Logically, also 52% of the deaths that happened in the month of May happened in rural India. So there was a sudden surge in the number of deaths because of the shift to rural India. That is what we're saying in our report.
When you're saying surge in the number of deaths, in May is when we saw a peak of 4,000 daily deaths that were reported. Of course, there were many reports talking about how the number of deaths itself were underreported. How much of this came from rural districts? Because you said that that is the period when you surveyed as well for this report.
So I'll just put it in perspective. So India till about end of May had reported seen around 300,000 deaths starting from January 2020. And in May alone, out of those 300,000, 100,000 deaths happened in India. So basically, we're talking about 1/3 of the total deaths in the country happened in 1 month. And over there, 52% of those deaths happened in rural India, according to our analysis. So that basically puts in perspective how bad things were in rural India. And from there, we go a step further. And what we look at is, and this is government data that we've looked at in our book. So we have looked at government data, which is updated in March 2020, where we look at the rural health infrastructure. And we find that it is extremely lacking. So there are 2 points that we were able to clearly see, and this is something that we also know in common knowledge. One is that we don't have enough number of health infrastructure in rural India. And the second thing that we realized was that the existing infrastructure is acutely understaffed. So that basically is one of the major reasons why there was such a surge in deaths along with the surge in cases when the cases actually shifted to rural India.
So you're basically saying that there wasn't enough manpower, and this is something that we've been talking to people on ground as well, at least here on the Rural Report. A lot of people on ground in Bihar and UP, Maharashtra, have been telling us that there aren't enough doctors. Is that what you're effectively saying, that there is a problem of shortage of doctors, radiographers, technicians?
Absolutely. So what our report shows, and this is again, I'll repeat, it is a government, these are government numbers updated till March 2020. That's basically the start of the COVID period. In rural health infrastructure, there are three levels. We've got the sub-centers. Sub-centers is basically at the bottom end. Over here, we do not have doctors. We only have health workers. Then at the second level, we've got something called a primary health center. This is basically the first level where rural India gets access to doctors. So you have a general physician along with allied staff, health workers. And then you have got something called a community health center. Now, community health center is basically where you get specialist doctors like surgeons and pediatricians and all. So if we now look at the numbers, so according to the government norm, let's start with the community health center level. So according to the government norm, one community health center should cater to 120,000 population. However, in March 2020, it was serving 171,000 population. Similarly, at the primary health center level, it is 30,000 is what one primary health center should cater to. But in actual practice, it is catering to 35,730 people. So this shows how much more infrastructure is needed at ground level. And then when we move to the second level, these infrastructure, these health institutes, they are highly understaffed. So this is basically another thing that we realized when we were looking at the numbers, government numbers.
Help us explain, which states, for instance, were the worst affected because of this.
It's very difficult to have a direct correlation between COVID and this. However, if you look at the numbers, so I'll just jump to the human resource shortage over there. So at community health center, and just to put it in perspective, so community health center, there is a 76% shortage of doctors. All India level. So it basically means all states are equally problematic. However, the best state is Telangana, where there is a shortfall of 25%, 24% according to the government data. Worst states include the northeastern states of Mizoram, Manipur, Meghalaya. We also have in Maharashtra, there's a shortfall of 64%. Then in Gujarat, there's a shortfall of 99%. In Haryana, it is 94%. So it's very difficult to say which exact state is really problematic over here, because it's a problem across when we talk about the community health center level. At primary health center level, the staff shortage is comparatively lower. So we're basically looking at 7% shortage across India. And the worst hit states over there is Chhattisgarh, which has got a 51% shortfall. So primary health center is basically your general physician. So 51% shortage over there in terms of doctors. Jharkhand has a shortfall of 24%, and Ladakh has 69% according to government data.
I also want to talk about vaccination per se. So far, India has managed to vaccinate about 3.13% of its population. If you can help us understand how critical is that in rural India per se, how much of that share goes to rural India? Is there any information on the rural versus urban divide?
So we did not look at the rural India part of it in the book. However, there are media reports suggesting that rural India is not getting as much as it should. However, what we looked at, and this was a bigger fear that we had in mind. So basically, the general discourse right now is about vaccine hesitancy in rural India. However, what we found was that there is an acute shortage of vaccines. So logically, the more remote the place is, the more difficult it would be to get the vaccines. So what we looked at is that we looked at month by month how many vaccine doses were administered in the country. So if you look at, so what we found was that in March, so it started in January, mid-January, I think the vaccination drive in India started with health workers, frontline health workers only. By March, in March, we had administered 51 million vaccine doses in the country. In April, it increased to 78 million doses. In May, when the cases were actually going up, as our numbers show clearly, the total number of vaccines that were administered was only 56 million. So basically, it had peaked in May already. However, the government has now assured us that new vaccine deals are being struck and numbers would go up in the future. But it looks like while the COVID second wave had not peaked, the vaccination drive had in some way peaked in the country.
If you can also tell us then, how has this impacted the population in rural areas per se? Because you also in the report talk about problems with Manrega, delayed payments. You also say that a slowdown in rural areas will impact the economy. So help us put all of that in perspective as well.
So Manrega played a very critical role in the first wave of first wave of COVID-19. So when we look at the numbers, when we compare it to the first wave and the second wave, so in the first wave, if we go back, so in April, which was basically the month when the lockdowns were in place, there was a sudden drop in the demand for Manrega, which was explained by the fact that people were not able to go back to their hometowns. Uh, then in May, there was a sudden surge. So we found around 37 million people had asked for jobs under Manrega in May, which is one of the highest levels we've seen ever. However, this time around in April, it was around 27 million as opposed to 13 million the last April, and in May it was around 27 million. So there wasn't a peak. 27 million in May is somewhat the average if you look at the previous years. So Manrega is dependent on the farm cycle. So when there is an off season, more people enroll under Manrega. When it is an on season, less number of people enroll under Manrega. So there wasn't a spike per se. However, what we also found was that there were delays nonetheless. And in the COVID situation, the delays would have hurt really bad. So what we found was that there was a delay of 209 net, so it is around 209,972 lakh rupees of delay. So, and out of which around 14% of the delays were more than 90 days. The payments and delay was more than 90 days. So basically people waited for 3 months to get their payments under Manrega during the COVID period. So that is basically what we have tried to show. However, this was not alarmingly high this time around because now this is our assumption. We don't have numbers to actually prove that per se, but what our assumption is, because the second wave had actually hit the rural India so badly, the economy overall did not shrink as bad as it did in the first wave because of the immediate lockdown and the immediate shutting down of the industry. This is something that has also been proved by the recent government numbers as well. So if you look at it, what has happened is immediate impact of the economy has not been that acute because the rural economy is what has actually slowed down, and the share of rural economy in the overall Indian economy is slightly smaller. So all the other industries, the manufacturing industry and the other industries have actually picked up in this quarter. Rural so but what we have found is that the rural economy will take a long time to recover. So the impact of this would also be felt in the next GDP. So that is the point that we have made. So immediate impact or economic immediate impact of economy has not been that acute this time around as opposed to the first wave. However, this will be much more prolonged. So the recovery would take longer, primarily because of the slowdown in the rural economy right now.
So, how much longer then? Because right now we're talking about decline in cases. The government has sort of been briefing the media every single day saying that the cases are declining, positivity rate is declining. And that is good news, they say. But how does it pan out in the next couple of months? Because we're also talking about experts saying that there could be a third wave as well. We don't know what's going to happen of the end of the year. Uh, so, how will this impact rural India then in the next couple of months?
So we have no reason for not to believe what the government is saying right now in terms of numbers going down. Even anecdotally, we can see that the number of cases are going down. In our circles, there are not many cases anymore. However, if the third wave comes as it is being predicted, and if it again hits rural India, which we do not have any reasons to believe otherwise, because rural India is already going through a bad phase right now, and we don't have. So the biggest problem with this entire so COVID-19 has in a way exposed the limitations of our rural health infrastructure in a way. Even our urban health infrastructure, if you remember during the end of April and early May, I'm confident even you would have heard of stories of people desperately trying to get hospital beds and we were not able to. So if it can happen in Delhi, in Bombay, in metropolitan cities, you can just well imagine what is happening in rural India. So the problem is, even if there is a spike, and by the looks of it, there might be a spike in the future, then things will again go back to normal. It would again worsen because the basic fundamental thing, which is basically we need doctors. That is the one basic thing that we need. We need good infrastructure. Those two things are lacking. No matter how much makeshift arrangements we make, it is not going to plug the fundamental issue.
So we're going to keep a very close watch on what's going to happen over the next 1 month, 2 months at least. And for now we need to address the issue of shortage of manpower, because that is the most important thing. And like CSE has pointed out in this report, I'd like to repeat again, they've said community health centers in rural India need 76% more doctors, 56% more radiographers, and 35% more lab technicians. And right now, as far as second wave is concerned, rural India is the worst hit. We're going to continue to track rural India over the next couple of months. We will be picking up stories here on the Rural Report. If you want us to pick up something, do let us know as well. Give us feedback on the show. Mr. Sengupta, thank you so much for joining us.